Hello everyone, we are here again. Welcome back to Aligners Intensive, the Advanced Biomechanics and Adjunct Therapies part. Okay, I'm very glad to be here with you again. And in this webinar, this class, I will cover one of the topics that I am studying more in the past years, right? Something that I am using a lot in my cases, and something that here at the DSD Planning Center in Madrid, where I am coordinating our treatment planning service, we are recommending to a lot of clinics. Okay, this topic, it's something that really can improve the predictability of your treatments with aligners. Something that is very easy to implement, okay, because as you can see here, in this topic, the class number 4, we are going to start talking about a maybe polemic topic, right? Because when we mention accelerated orthodontics, something that creates some controversial feelings in a lot of people, right? And also about bone modulation, okay? This is a very comprehensive part, and that I split it in 3 classes. The first one, I'm going to discuss the non-surgical approaches that can facilitate orthodontic movement. Listen, it's different, accelerated and facilitated. Acceleration is something that will require much more factors, much more tools, and much more things that needs to be done to happen, okay? But this approach I'm going to share with you, it's to facilitate orthodontic movement, okay? We understand, and we already review in other classes, okay, and I have been discussing this since the course last year, where I discussed the basics for orthodontics with aligners, that we have some limitations in terms of orthodontic movement, right? We have a saturation point that aligners are very good for us to calibrate this, for us to go until the limit, for us to use the artificial intelligence of the software, so we can be sure that the force we are applying is within the margin, this saturation limit, and we're going to always work with ideal forces. Okay, so the major companies for aligners, they have a great system to calibrate the force, and this is something that the artificial intelligence can really help us. Okay, because it's very challenging for us to calibrate the exact amount of force that we need to apply to be effective in movements, okay? But understanding that in terms of biomechanical stimulus, we have these limits. We know that we cannot apply more force, and it's not meaning that we are going to move the faster. How can we be better? How can we be more predictable? How can we promote movements, faster movements? The answer is not in our efficiency in terms of the biomechanical stimulus. So a lot of discussion we have nowadays about the system, right? About the self-ligating, aligners, regular braces, which one is better, which one is faster. But the fact is, all these systems, they can provide better control for certain movements, others better for others. With the aligners, in my experience, and from who already tested all kind of systems, is the one I have better control in terms of the biomechanical stimulus. Okay, this is my opinion. I know a lot of doctors, they can work better with other systems. I completely respect this, and this is not what we are discussing. I think the most important thing is the person, the dentist, the orthodontist behind, controlling the tool, okay? But I cannot be more efficient. I have certain limits with this system I'm using, the aligners, because I just shared with you in the previous slide, the biological response will occur until certain level of force we can apply, okay? So we need to think how to improve, or how can we extend this saturation limit so we can apply more force. This is one way to go. Or how can we make it respond faster, right? The same amount of stimulus, the same force, the physiological force, so we won't need to apply more force. We can have a better and faster biological response, a better bone remodeling process, okay? So here is where this next 3 class we will concentrate, okay? It may look so kind of complex. Don't think, please, don't leave the room right now thinking I'm going to just talk about biology, because it's not what is going to happen. I'm going to show some facts, I'm going to present some articles, I'm going to share some clinical cases, and I expect by the end of this class today that you can be ready to start using this technology tomorrow, okay? So this is the whole idea, so you can implement this, and I'm going to show not only the science, but also the practical part, the clinical part, and also the business part, how it's good for your business, okay? So we have been discussing also that the orthodontics can work within this envelope of movements, considering orthognatics, skeletal anchorage, and the whole idea from this class today and the next 2 is how can we overcome the limits, okay? Let's be fair, the previous class when we discussed TADS, the temporary anchorage device, the skeletal anchorage, is also a way for us to expand and overcome our limits. But here I'm talking about better movements, I'm talking about faster movements, more predictable outcomes. So we have some methods, okay? Here you can see it's accelerating tooth movement in Portuguese. I'm sorry, I forgot to translate this to English, but I'm translating to you. In this box is accelerated tooth movement, okay? And in a summary, what we can see in the papers, what we can see published, that researched ways and tools that can accelerate tooth movement, okay? We can see some articles showing the effect of drugs and vitamins, okay, with some limitations. Also the use of laser, it's very promising, we have good studies about it, but also with some limitations in my opinion, because both of these 2 techniques, drugs and lasers, we have limited outcomes, and also the need for the patient to come to your clinic and repeat the procedure, repeat the use of the medicine, so we can keep having this effect during treatment. And in my opinion, in my reality as a clinician, is not practical, okay? We also, both are non-surgical methods, okay? We also have the surgical methods, the most, probably the ones that we have the biggest amount of studies and papers in the literature, okay? With corticotomies, piezo incision, micro-osteoperforations. We are going to discuss in this next class when and how can we use these techniques, okay? And we are going also to discuss today these methods here, right? Mostly the high frequency vibration, okay? We have 3 main methods that is I consider worthy using, okay? And in my experience, the one after researching that provides the best cost benefit, the one that provides the best amount of benefits for the patient in terms of everything, cost, effect, it's more practical, is the high frequency vibration. We also have the low frequency vibration and also the photobiomodulation. Both they have their characteristics, okay? But basically, the next 3 classes we are going to review these 2 most important methods, the surgical and non-surgical methods, to improve the bone remodeling process and to improve the way teeth is going to move in a faster way and more predictable, mostly with aligners, okay? So, what is the Vipro, right? Vipro is a device, it was developed initially by Propel Orthodontics. This is a company that was situated in the Silicon Valley in the United States, and they developed together with the New York University a technique called high frequency vibration, and they patented this device, the Vipro, okay, which is practically the only way nowadays with the proper amount of studies proving the efficiency available in the market that you can use to accelerate tooth movement without any surgery, okay? So for me, the association between the high frequency vibration with the Vipro and aligners, it was a game changer for my practice, okay? This is something that I saw initially in a congress, the first time, the clinical cases. So you can see the AAO, the American Association Orthodontics Congress in 2019. This one, if I'm not mistaken, was in Washington, right? I could be there lecturing with my experience and also seeing a lot of very important orthodontists, a lot of important doctors with a lot of experience, teachers in universities like Massimo Shiri, clinicians with a lot of patients, Jonathan Nicozizis, Kenji Ojima, great reference with aligners, Nazib Balud here, my friend from Mexico, a great self-ligating braces doctor and now using a lot of aligners. A lot of other doctors sharing their experience with these technologies, sharing their studies, their clinical perspectives and the clinical results. And for me, it was a validation of what I was seeing in my clinic. Okay, so it was a very important moment where I could see with my own eyes, not only my case, but also several other doctors' cases, right? And I could collect some cases that they allow me to use just to exemplify here. Okay, for example, this one from Jonathan Nicozizis, where he could solve with aligners, plastic, right? And the use of Vipro, where the patient could change 18 aligners in 4 months. Okay, just using 1 time per day, 5 minutes, this device. I'm going to explain a few. Okay, this other case from this doctor, Bella Shane Garnett, 47 aligners case with an open bite. She could move in 10 months from this open bite to this final outcome with only 8 visits and using the Vipro, changing aligners faster. Okay, and this other case from Gary Brigham in 5, almost 6 months, 43 aligners, again another open bite. So I was seeing a lot of beautiful cases, a lot of complex cases with the patients changing aligners every 5 days using this tool, okay, this technology, the high frequency vibration together with aligners. And it was blowing my mind because not only changing aligner faster, but also improving the predictability, okay? And this is what I want to validate with you today, okay? Not only with the other doctors' cases, but with my experience in my cases. And please, I know you probably have a lot of questions about this. Maybe for some of you it's new. Maybe still is not available in your country and you need to check for other options, okay? But the sooner you know this kind of technology, the sooner you ask for the companies you have available in your country to develop something similar or to bring this technology to your country, the best for you, for your patients, and for your practice, okay? So this is this device already changed a lot with new, we have a more recent version, but the idea is here. It's a very simple device with this mouthpiece, and this is a vibration part that creates and generates this high frequency vibration with 120 Hertz and 0.3 G of force, okay? So this is the perfect combination for us with the patient using only 5 minutes per day to allow them to change aligners in 5 days only, okay? Okay, Daniel, but I already changed aligners in 7 days. My company says that I can, and I'm changing. So it's not a huge difference, okay? You're going to see that, yes, we have a huge difference because changing aligners in 7 days without any help, we're going to reduce a lot the predictability of the movements. So we are going to leave a lot of movements and to the additional set of aligners, and we will increase the number of aligners for the additional sets, okay? And changing in 5 days, it's even faster, and the predictability we have is much bigger compared to the 7 days. So we can accomplish more with less aligners. Okay. So the whole science behind what we are doing with this vibration. Okay. This vibration is not just to seat the plastic better in the crown. It's not to improve the tracking. Okay. The vibration using this high frequency level in 120 hertz, it's going to activate and to stimulate a lot of cells here, inflammatory cells. So we are going to work in the active part of the treatment where the appliances are promoting this force on the crowns, and we are stimulating an inflammatory response. So with the active treatment, we are going to stimulate this process with osteoclast and bone resorption and formation to be increased. Okay, and it is also interesting to be used in the retention phase when we don't have more orthodontic force, because here what we're going to do, we're going to keep stimulating these inflammatory cells, and during this phase when we are not stimulating more with appliances, we are going to stimulate a better density in the bone, a better quality in the bone. So we can speed up the process of formation and resorption during ortho, and we can speed up the density and formation of bone, improving the retention phase. Okay, so we have this dual mechanism. Okay, we in the anabolic phase, when we are applying force, we are going to increase the presence of the cytokines. Okay, we're going to have more osteoclasts, and we're going to decrease the bone density. Okay, in the catabolic phase, when we are in retention without any force, we're going to increase the presence of osteoblasts and increase bone density. So we can work both ways. Okay, and in my opinion, the biggest benefit, the one that the patients really want and really look for it, probably this is going to be the benefit number one for you to promote this in your clinic. Okay, is that by doing this, by allowing the presence in a bigger number of these inflammatory cells, we are going to promote a better bone remodeling process, and a consequence of that is the biomechanic stimulus that we are applying is going to be more effective. The movement we want to accomplish with this aligner is going to happen faster, and then we can change aligner faster. Okay, so this article, it was published in 2015 in Angle Orthodontics, one of the most important magazines for orthodontics, and they studied 15 patients, right, using high frequency vibration, in this case electric toothbrush with 125 hertz in only one crown. Okay, and they found 3 times more cytokines and inflammatory cells that are associated with this osteoclastic activity. Okay, so this was the first study after having in the market other devices with low frequency vibration that presented some biological outcome, some biological response using vibration. Okay, so this was a game changer. Okay, so here in this other study now with 206 subjects, okay, it was evaluated in different protocols and different vibrations using a control group without any device, a group with low frequency vibration, and a group with high frequency vibration. And the amount of movement that was promoted in the group with high frequency vibration was almost the double compared to the control, and almost the double compared with the low frequency vibration. So it increased significantly the rate of tooth movement. Okay. In this other group, the presence of these osteoclastic cells, this osteoclastic activity, it was much more present. This was the same study, sorry, the one with 206 subjects. They also evaluate the presence of these cells. And in the group of the high frequency, you can see here in gray that in 3 days, 7 days, 14 days, and after 30 months, every time the presence of this osteoclast cell was bigger. Okay, and it was more prolonged. So in this other study with 60 subjects, it could keep the presence of these cytokines, these inflammatory cells, in a much higher volume in the sample that used high frequency vibration and changed it in 7 days, and the sample who changed in 5 days with the high frequency vibration, the black and gray here. Okay, so by doing this, we can actually change aligner faster. Okay, and also we can reduce the discomfort. Okay, so this is something that we can see in this. Let me go back here in this other study. Okay, because besides we can change and promote this better bone remodeling process with the bigger presence of these cytokines, these inflammatory cells. Now I'm talking too much about biology here and cells, but it's important for you to understand this concept. By doing this and promoting this faster bone remodeling process, we are going to allow the periodontal ligament to decompress faster and to allow patient to feel less pain, to be more comfortable for the patient. Okay, so in this study with 60 subjects, okay, they tried to change aligners without any help of the high frequency vibration in 5 days, and it wasn't possible for the patients to continue because it was too painful. It was too much discomfort. Okay, too much discomfortable for these patients. And the sample who changed in 7 days without any device, it was the highest rate of discomfort besides this other group that discontinued the study because it was too painful. Okay, and then we have 14 days. Okay, in this rate, this numerical pain score, when 5 it's too much pain, and here almost no pain at all. Okay, in the first day after we activate, it was very high, the level of pain in the group that changed in 7 days and also in the group that changed in 14 days without any high frequency vibration. And the group that changed in 5 days, less than the 7 days and 14 days, could have a reduced level of discomfort here. Okay, and also the 7 days group, it was the most comfortable one. It's impossible for us to talk about reduction of time without talk about this word, predictability. Okay, because for us to accelerate something, we need to better plan, we need to have a good diagnose process, otherwise we're not going to accelerate nothing. Okay, so considering that we did a correct plan in the software, okay, we plan our movements, the staging, the attachments, all the movements we need to accomplish the final outcome, we are going to have changing in 5 days in this right column in blue, the same rate, the same amount, proportion of predictability compared to a 14 days aligner changing. Okay, it means that a patient that is changing in 14 days can have the same amount of predictability changing in 5 days with the VIPR, with the high frequency vibration. So when we compare the 7 days that some companies preconize and suggest as a protocol, and we see this kind of study that can show clearly that changing in 7 days can reduce the amount of predictability, it's much different for us to change in 5 days. It's only 2 days less, but it's still less, but having 84% of predictability, meaning that compared to the 100% that we plan, we're going to achieve 84 according to this study. If we fall out to 70, we're going to leave in 7 days, 2 days more, and we're going to leave a lot of movements to the additional aligners. Okay, this is why the protocol I have been using for my patients is the 5 days aligning changer with the high frequency vibration, because I can have the same control I have compared to the times that I used to change in 14 days, but compare 14 days with 5 days is 60% faster. Okay, so I can finish the first set of aligners much faster compared to the usual protocol I used to use in the past. I need to be fair that with the time and getting better with aligners, I start changing in 10 days, and I can change in 7 days for some few cases. Okay, but even for these few cases, I like to use the VIPR to increase the predictability and be able to change in 5. In the end, it's better for the patient. Okay, also I can reduce the number of refinements by doing this. If I am more predictable, even changing in 5 days, I can leave or nothing or much less to the additional set of aligner compared to a regular protocol. Okay, this is a study done by Thomas Shipley, a North American orthodontist that I really am a huge fan, who tested a lot these devices in his clinics. Okay, and here he compared in 2 samples of 8 subjects, changing in 14 days and other in 5 days. And the sample that changed in 5 days with FIPRO didn't have any refinement. He could finish treatment much faster compared to what was planned originally. Okay, so a great information for us to present to the patients. Okay, and regarding the retention, okay, also an important phase of the orthodontic treatment, we know that if we don't take care of this moment, a lot of times the outcome that we achieve is going to be lost. Okay, and we know that there is no 100% effective system to use as a retainer. Even the fixed ones, we have issues. We can have relapse. We can increase decrease the hygiene, retain more food, and periodontal problems. So I really like to use the combination of a removable, not a liner, removable retainer made with acetate, and the high frequency. The patient keeps using it in the retention phase. Okay, so I can increase the bone density and reduce the chances for teeth to move. Okay, so this study here, it is presenting this, comparing static, the patients who finished treatment and didn't use no vibration, only the retainers. Okay, so the bone density didn't change much. Okay, the ones that used the low frequency vibration had a good improvement, but with the high frequency, it was amazing how bare the bone was after certain time using this. Okay, and the difference also mostly for the maxilla, which is a less dense bone, a more trabecular bone. It was incredible because the comparison between the control and the sample that used high frequency vibration, it was much bigger, the density of the bone, allowing teeth to be more stable. Okay. Also a good study here, a lot of doctors, they ask me a lot of times about the root resorption. Okay, Daniel, you are telling me that I can change in 5 days, but it will create more force, it will improve the the root resorption. And the reality is that it is the opposite, because remember, I'm not going to increase force. I'm using the same set of aligners. Okay, I'm just adding these two. I'm just adding the high frequency vibration. And with these, I'm going to make bone to remodel faster, allowing us to change aligner faster, because it will decompress the ligamental periodont faster and will make the bone to be ready for the next activation also faster. Okay, what are the 2 most important factors that can cause root resorption? We need to remember this. One is longer ortho treatment, okay, a long time in ortho treatment, and this device will reduce the treatment time, so it's good. Okay, and another factor is long periods with the root with force and with osteoclastic cells. By using this device, we're going to remodel bone faster, decompressing the periodontal ligament, and also we're going to reduce the time the root is going to be in contact with these cells. So this study show this. Okay, this study is showing that the sample that use aligner plus VPRO, the high frequency vibration, they presented a smaller amount of root resorption than the control that just used aligners and change it in a bigger period of times. So amazing news, right? So imagine this case that you receive the patient that is using braces for a long time, and you do an x-ray and you can check that there is a lot of root resorption. Then, well, what you are going to do? This is an amazing adjunct tool to use in these situations, because we can protect the roots. Okay, so keep this in mind. It's not going to increase the root resorption, and the idea is not to change our protocols with the aligners. We're not going to increase force, This device is going to work in the other side, promoting a better bone remodeling, and in consequence, when you have a good diagnosis, when you have a good treatment planning, when the patient has a good collaboration, everything is well, this device is going to just add and make it better, okay? Alone is not going to solve, but together with all the combination of these good decisions is going to be an incredible solution, okay? This was published some time ago, so we are talking about doctors who they are using for a long time, and 5 years ago, Sandra Tai already mentioned that she used routinely in his practice, okay? Propel, just to be clear, is not the one who sells Vipro anymore, okay? Dentsply Sirona bought Propel assets, and now they own this technology, okay? So if you want to look for this device, you can check for any Dentsply Sirona provider or distributor in your area, okay? You can find probably other companies selling this device, some from China. I prefer using this one because it's the one where I found the biggest amount of data and studies, and my patients never complain, okay? But here, let's talk about high frequency vibration. And what she also mentioned here, right? Improve the seating, I could check this. Allowing many patients to sit aligners faster, this is my experience too. And also improve discomfort and increase clinical predictability with less refinements. Everything I shown with studies, she is providing her clinical opinion, okay? Well, let's share some clinical cases here, okay? Which is also always good for us to brainstorm. So my first experience using the Vipro, right, with aligners was for this special patient, special in the sense that he didn't live in my city. He didn't live in my country. I was practicing in Brazil, and he used to live in the United States, okay? He's a Brazilian who lives in New York, and he was looking for orthodontic treatment. Since he was from my city, he looked for me, and he mentioned, Daniel, I want to treat, but needs to be with some appliance that allows me to treat in distance, okay? Because I'm going to United States and I need to do the treatment from there, okay? The third thing I eliminated was braces at the time, right? Because how can I treat him without seeing him from time to time? With braces is impossible. So I present to him the idea to use aligners, right? In his case, and he agreed, okay? I explained how it worked. It was new for him, although he heard about it, but he didn't have a clue about how it would work. And then I explained to the reason why he looked for this treatment was to correct this open bite and lower crowning, okay? And he also mentioned, as you can see here, that his arches are kind of narrow, right? In his words, he wants to expand more, to feel more his smile with teeth, okay? So I ordered the plan so I can make all the modifications in the software, okay? And the outcome of this planification is this 20 aligners project, okay? Where I'm going to expand, opening space to align and level this crowning, okay? If you go back in the other classes I have with OIJS, okay? In the previous course when we discussed biomechanics, you see that this expansion with aligners is very predictable because the plastic can use the right side as anchorage to move the left side and the left side to move the right side, so the plastic can really be effective doing this kind of expansion in adult patients, right? So 20 aligners, we didn't need it to, I don't need to create any sequential movement strategy here, as we discussed it also in this course. So it's a predictable set. But what is not predictable in cases like this? For him to correct his open bite and looking to his smile, in my diagnostic process, in this moment, I didn't use the DSD method, okay, with the frame, the lines that we already discussed here. But I evaluated his smile, and he doesn't show a lot of his upper incisors, right? So we have margin to extrude a little bit. And since it's not much, I split the amount of extrusion from half in the upper, half in the lower, as you can see here, also expanding, okay? One issue I had is that since he doesn't live in Brazil, I saw him in August 2017, and then he went back to United States. 15 days later, we connected online, okay, and then we discussed the plan. He approved the plan, and he commented with me that he was coming back to Brazil after 2 months to start the treatment, okay. So in this time, the aligners already were with me, and when he got to my clinic again in November 2017, I have everything ready. And then he mentioned to me, Daniel, I will go back to Brazil and come back in 6 months. So I need the treatment to be done, otherwise I will need to expand more tickets. What can we do to achieve that? So I commented him about this technology, the high frequency vibration that could allow him to change aligners faster, because for him, changing in 14 days, a patient that I'm not seeing every month, I'm more comfortable with this protocol, it would take 10 months, and it's more than 6 months. So with the Vipro, I created for him some scenarios, right? First, I like to compare with the conventional orthodontics, right, with braces. This is the kind of case that I would do with braces also fast. I believe between 6 to 12 months we can expand, improve the crowning, and solve his case. But it wasn't possible because, well, he didn't live in my city, and I need to review the patient and change wires, so it wasn't possible. With aligners, considering 20 aligners, the best case scenario, changing in 7 days, it will be almost 6 months. And what it would happen with a bad collaboration and changing in 14 days, it would be 10 months. Okay, so it was out of the time frame he asked me to finish his case. Okay, and then with the Vipro, it would be possible, even in the worst case scenario, to change it in 7 days with Vipro, to finish before 6 months. And then I could convince him to use this technology by showing these facts. Okay, here he is with the first model of the Vipro. Okay, they called Vipro 5 at the time. The patient needs to use like this. He placed the device with the aligners in his mouth. Okay, so he insert the aligners and then connect in this button here, clicks, and it starts vibrating. After 5 minutes, it turns off alone. Okay, and then that's okay. The patient just remove, wash the device, and keep with the aligners in his mouth until he needs to remove. Okay, this is something I recommend him to use at least 1 time per day. But I did it 2 times per day. This is my protocol for my patients. 5 minutes, 2 times per day, ideal, okay? At the time, it came with this software to check if the patient used correctly all the times I recommended. Nowadays, we have like an app, okay, that can connect via Bluetooth, so it's easier and faster. And then, with this protocol, we could reduce to 3.5 months the first set of aligners. Imagine 20 aligners in 3 months and a half, and the patient changing in 5 days for him to be ready with extra time, in time for him to come to Brazil for us to evaluate. Okay, and this is what happened. This is what we could achieve after 3.5 months. So we could solve his main problems, close the open bite, correct the crowning, good predictability, expanding the arches. And he kept using this device to allow the retention to be better. Okay, so compared to an estimated treatment time initially of 10 months, by adding this technology, we could achieve, without changing anything in the software. In this case was the clean check. Without changing anything in the clean check, we could achieve the same, an ideal outcome in 3.5 months. Okay, and here he is with his new smile after 3.5 months and no refinement. So I was pretty much happy with this first case, and after this first case I was much more encouraged to I recommend this to my other patient and start using as a protocol. Okay, because I was living in the south of Brazil, and because I start using this technology, I start giving lectures about aligners, acceleration, and I helped Propel at the time in Brazil to come to my country. And I start traveling a lot because of the courses. I get to know Well Clinic. Well Clinic is the Christian Coachman Family Clinic in Brazil, where the concept of DST was created. And then I added one more tool, the digital smile design, in my portfolio for my patients. So now my treatments they are even more accurate, because I can test right before, I can simulate movements, I can check the design with patient's face, I can be more assertive, I can be much more direct to the point in the movements I need to do. Okay, checking CBCT, checking out the images, testing the patient's mouth with the mock-up, measuring. So here it's very clear that we need ortho. Okay, in this design, checking in the patient's face, and then moving this design to the clean check. Okay, we have 30 aligners for this important crowding. Okay, much bigger than the other case. 30 aligners, a little bit more of aligners, 10 aligners more. And here is the plan, okay, that we developed at this moment. It is like 5 years ago, I believe even more. So I changed a lot of my protocols in terms of attachments. At the moment, this is what we decided to use for him. Okay, and I comment with this patient that exists this vibration device, and he didn't think twice. When I explained him that he could change in 5 days instead of 10 or 14, this was something that for him it was very important. Okay, and here we can see that planning the movements with the design in mind that we already tested in patient's face is much easier. Okay, much better. And 30 aligners using the vibration, this is the outcome we could achieve in 5 months. Of course, it's not ready here, but in just 5 months, we could get to a much better condition, solving the most important problems. And now the additional set of aligners, because it was a complex case in terms of crowning, and additional aligners are very common and normal for this kind of cases. Now the additional set is much easier and simpler. So I transform very fast a complex case in a very simple one. And now I can plan the additional set much easier. Okay, look the difference, the amount of crowning we had and what could be accomplished in just 5 months. Okay, again, I didn't change the sequence of the aligners, I didn't accelerate anything in the software. I just added this device that the patient used 2 times per day, 5 minutes. Okay, and here is his smile. Here he was pretty much happy. Here he wanted to finish the case, but since it was very fast the first set, then I showed to him that the plan in green, sorry, the final ideal in blue, and what we have now in green, we still need to move a little bit more to achieve the outcome we planned initially. And after 5 months, everything happened so fast that, okay, let's do it. The patient was still with a lot of gas, with a lot of energy to keep going with the treatment. The problem with treatment like this, by not using the Vipro, is that it would take at least the double of the time, 1 year at least. Okay, and then to ask the patient to use more, I don't know, 8 months is something difficult to convince them, right? And most of the time the patient forces to finish before the aligners. It has this downside. Okay, if the patient don't want to continue, he's not going to use the plastic. Okay, with braces we can convince and not remove and keep going, also not good, but happened a lot in the past. But by finishing the first set of aligners in 5 months and suggesting an additional set of aligners that we can keep using the device and reduce the number of days the patient is going to use each aligner by half, we can also finish very, very fast and not doing 8 months, for example, in 2 months. So it's something that in the end is going to be very reduced the amount of time. Okay. This other case, also a complex case, also with the same workflow. Okay, this patient was seeing a lot of dentists, a lot of orthodontists looking for treatment. All of them, they are planning extraction, and this is something we couldn't avoid. Okay, this case it's different because the patient he works in television, and he wanted to change this condition as fast as possible. Okay, an important crowning. We can see here that this is the kind of case that extraction can be considered. Although if I had more time and the patient more patience, I would encourage him to maybe try with skeletal anchorage to finish the case without. Okay, but here we simulated, and by simulating we can test drive. And if it's not a good idea, we can see that before starting the treatment. Okay, so we could check the design, overlap here with the extraction, and then see the effect in his face. And he was happy. We explained the limitations. We weren't reducing a lot, retracting. We are also increasing the space, the transversal space. So for the tongue, it wouldn't compromise the airway. Okay, and the patient was happy. And here we have the pre-acceptance phase. Everything we do to present to the patient the treatment idea. Okay, initial planning 3D, virtual mock-up. Here is the mock-up. This is something that we just place using this design. We print this design, we move the design a little bit forward, we print, and then we place in his face so he can have this taste of what is going to be the outcome. Okay? And he was crazy about it. He accepted the treatment right away. Okay? And then we transfer this idea of treatment to the software I like to plan the case. Okay, the ClinCheck. So we have here 46 aligners in the lower, 32 in the upper, okay, with extraction. Okay, so this case, it was the whole idea, extracting 4 premolars, okay, to make these movements. And the whole idea here for us, the first set, 46 aligners, our target was to change in 5 days and to finish in less than 8 months. Okay, so we can go to the next phase, or we can go to the additional set of aligners, but we can solve the main complaint of the patient the sooner the better. Okay, and here he is after 7 months and a half. Okay, so he was very happy already with his smile. Okay, and we did a quality control where we can overlap what we planned with what we achieved. We can see that we still need to retract a little bit more, but it was a decision. It was not bad aesthetics, so maybe it's not necessary. We can keep in this position and avoid retracting even more. All the quality control moments when we are going to check and overlap, it's an important moment for us to make new decisions. Okay, here the overlap between ideal and achieved, and we can have in a huge improvement between initial and the end of the first set of aligners in last the 8 months. And again, we didn't change anything in the software. We keep doing the same protocol of force. Just by adding the high frequency vibration, we could reduce a lot the time. And he was taking the photos in television. He authorized me to use in my courses, so he was very, very happy. Okay, I'm going to move very fast here. Okay, for us to finish in time for questions, but not only for orthodontics we can use this device. Okay, this is something that for an interdisciplinary case, a patient that is going to do ortho, is going to place implants, is going to make extractions, everything is related to bone biology, right? Because in our mouth everything is connected, and the tooth is inside the bone, and we have the periodontal ligament. So if this device can promote a better bone remodeling process, if this device can create a more dense bone and can interfere in this process, what it would happen for extraction, for example, where we rely in this new bone formation to have a better bone after the extraction, so we can place an implant, for example, or we can do ortho in closed space. What it would happen by using this after inserting an implant, where we need to heal this implant as fast as possible so the patient can have a crown over it also as fast as possible. Okay, so we have some studies, some data about it. So the most important information here, because of course we need much more clinical cases, much more studies, is to know that it's not going to create any problem. It's the opposite. It's going to promote a better solution for cases we have grafts, surgeries, and implants. Okay, so this first information, okay, associating the high frequency vibration with the bone quality and quantity. Okay, after 28 days, after 1 month, 4 weeks, right, using the high frequency vibration, a patient without ortho, just to check the effect in the bone, okay, a patient could change the bone type, increasing the bone volume in 19%, increasing the trabecular thickness in 27%, and decreasing the space. The bone was less trabecular, that's more dense without these bubbles here internally, in 26%. Okay, so it's like changing a type 4 bone to a type 2 bone, right? So these, for the retention, for implants, and the stability of any outcome after any treatment, to have a good bone density and quality is very important. Okay. Also, it's very important to have a good volume of natural growth factors when we are going to place implants. Okay, so even if you are an orthodontist here, if you are not working with implants, for sure you have cases that need implants. Okay, and this is something very interesting to discuss with your implantologist or with your surgeon, for them to know that, and to explain to patients that this device that the patient is going to invest or you're going to give to your patient is going to be useful not only for ortho but for retention, for the post-implant phases, okay? Because it can increase in a lot, 250%, the most important natural growth factors, okay? The bone morphogenetic protein, the epidermal growth factor, and the PDGF, which is platelet derived growth factor. They are intimately related to the amount of the quality of the osteointegration, and this is only after 14 days of usage of the high frequency vibration. Another thing that a lot of doctors, they ask me very frequently, okay Daniel, but I just inserted the implant. This vibration is going to create any instability, is going to create any force over the implant to block the osteointegration, to prevent from osteointegration? And the answer is no, because this vibration in 120 Hertz and 0.3 G of force is very far from the amount of displacement of the load that is necessary to surpass the safety threshold, to enter in a zone that can inhibit osteointegration. The amount of trauma of micro movement over an implant needs to be more than 100 microns, right? And with the vibration, high frequency vibration, we are very far from it. In fact, by working here in this zone and promoting a bare bone remodeling, a bare bone formation process, we are going to accelerate early bone healing, right? So amazing news, and we have a lot of studies presenting this. Okay, also very cool to know, for secondary stability, when we can insert the provisionals over the implants, it was much shorter the time we need to wait to achieve this stage, right? For example, we have an osteoclast count, okay, and a control group. We can, in terms of days, to achieve the minimum amount here, it was in 1 month, okay. We could have this amount and much less days here to achieve with the high frequency vibration. So we can get to the moment that we can place load over the implant much faster, okay. Also, sometimes when we have some extractions and we need to place an implant, or we need to preserve bone, okay, normally after 62 months, right, we still have the alveolus kind of empty and with the bone formation process ongoing, okay? And in this study, they did an evaluation in animals, okay? And here, initially, right after the extraction, we have all the alveolus there. And then after 14 days, the upper here is static, and then high frequency vibration, 20 days static and vibration. Look the difference in terms of high and volume after 56 days static and high frequency vibration. It formed much more bone and preserve the bone here. So for cases that you need to extract and later place an implant, this is a good tool to use and justifies even more for these patients that are going to do ortho plus implants to have this device in the treatment, okay? So if you want to take a print here, we have several references for you to study more, okay? This is something I have been studying to justify for my patients, and now you are taking this shortcut with me because I already had more than 200 patients, and behind here the DST treatment planning service, and doing more than 3,000 cases in the past 3 years, most of them using this device. It's a lot of cases that I can say that really work and it's really worth it, okay? So most of the time when you're going to insert a new device, a new appliance, a new protocol, a new workflow, a new technology in your routine, it's important for you to make this question: why I need to do this? Okay, so to answer this question, you need, this is at least the process I used to do. Okay, I like to first ask myself if it makes sense in the science. Okay, and today I presented to you a lot of studies that confirms that this is a technology that can promote a better bone remodeling process, can promote a better biological response, can increase the presence of the cytokines and inflammatory cells. If it is going to accelerate treatment or not depends on the ability of the orthodontist, the dentist, planning the case, diagnosing the case, executing, promoting the treatment. Okay? If you did all the correct decisions and you plan correctly, you are using a correct biomechanics, this is something that is going to improve your outcomes, okay? And the science is showing this, okay? I like to ask myself, this is something I would like doing, because you may say to me, Daniel, to place implants, it's good for your business, you should place implants, okay? Do I like to place implants? Do I like this kind of surgery? Actually, no. Okay, maybe I can do, but this is not something I would wake up in the morning, great, I'm going to place an implant. No, so I don't have a passion for implants, but for this device, it was love at first sight because it was very simple to implement. The patient very fast, they perceive the value and the benefits, and they are super thrilled about it. They comment with their families, it's something they can show, it's something they can share in the social medias, and they got excited the next appointment. So I realized myself that the patient that was using this technology, my appointment with them were much easier, softer. So I really like using this kind of technology that is great for the patients, okay? And the last question I'd like to make is this is something good for my business, right? It's interesting for my business. I need to adapt a little bit because in the beginning I was used to charge per month. Every month the patient goes to my clinic and he pays like a monthly fee, okay? For my business, I know it's good for the patient and this is why I adapted, but for my business, if I keep using this model, it's not good because I'm going to reduce the treatment time, great for the patient, but I'm going to earn less money. Doesn't make sense. I'm doing all this work, this effort, implementing technologies, be different from the others to receive less? Of course no. So why did I change? I start charging a closed deal, right? I charge for the treatment, and no matter if you're going to come to my clinic 1, 2, 3 or 2 years, I don't know, right? we are going to work together. You are going to pay the same fee. This is a closed deal, and both of us, we want to finish the treatment as fast as possible. When I start doing this, the patients, they really understand this concept. They really want to finish as fast as possible. Me too. It's good for both, and we are going to work together. And then this is the moment that this device changed my practice, changed my business. Okay, because here's some numbers just to finish here. We already are on time, but compared to when I was working with braces, the conventional way, okay, and then aligners, and Vipro. For a clinic, my clinic with only one chair, a small clinic at the moment, in my hometown in Porto Alegre, south of Brazil, I could see per month the capacity that I could see with conventional orthodontics, it was reduced, right? Because if I have a full schedule, seeing patients every day in the business days, I could, because it took more time in the chair, my capacity was very reduced, okay? With aligners, it's much more simple what we need to do in the chair, with the patient in my office, okay? So I could double my capacity, I could have faster appointments with less urgencies, okay? And the effect of adding the Vipro and reducing by half the amount of time and the visits in consequence, I could also in 1 month to double again the capacity of my clinic, okay? It means that I have always full my clinic, no, but this time that I'm not with the patient in the chair, I can use for other things, to study more, to go in the park with my kids, to train my team. So my capacity was much bigger and I was seeing less patients. Okay. Also for the patients, compared to normally it took me 24 months to finish a conventional orthodontic treatment with braces. Okay, so this orange here, dark orange, it was 24 months. What I realized with aligners, as soon as I understood the biomechanics, how to plan better, that with time, it's not from day one. Day one, a treatment with aligners took more time from me, but over the years, and with my experience and working with this since 2008, I could see the outcome of the case being reduced to half of the time, okay? I'm not saying that aligners are magic, but I could control the force, I could control several other aspects that with conventional braces I couldn't. And in my opinion, my experience, I could finish treatments faster. And since I can reduce the protocol and change in 5 days with Vipro, even faster. So I could see that I am seeing less the patient in my clinic. Okay? In a treatment that usually I used to see once a month, 24 times, a conventional braces patient. Now, with this combination aligners plus high frequency, I am seeing less than 7 times. So a great deal for me, because if I'm charging a closed deal, I will receive more per visit. Okay, every time the patient sits in my chair, I'm going to receive more, right? Because I'm seeing less and receiving the same. So this is something that improved a lot. Okay. Besides that, since I'm adding value when I moved from conventional to aligners, this differentiating factor allowed me to charge a little bit more for the aligner treatment. Okay, and then when I added Vipro, I was different from my colleagues in my city, and most of them, of course, a lot of them were using too, but I was charging more for each patient. Okay, so it increased a lot my capacity of differentiating myself and charging more. Okay, and again, considering that I'm seeing less the patient, less times, and I'm charging more, the capacity, the amount that I could charge per visit in the end, after splitting the total that I charge by the number of the visit, increased a lot. Okay, so this is something that, in my opinion, for your business, you should consider using, not only because it's great for the patient, okay, because in the end, this is the most important why. The biggest why here is, okay, it's what the patient wants, to do faster treatments, to be more comfortable. Only by this excuse, only by thinking about our patients already is a great justification. But it's also great for your business. It's also great for your numbers to see less patients. so and earn more. So it's not something that you should think twice, in my opinion. Okay, so the effect of it, the patients really love. They really like to share in the social medias. I'm not paying them. They are sharing because they want, because they think it's cool. And imagine this effect for your clinic with your own patients sharing the social medias that, look, this is, you don't need to put anything. This is, look, how cool my dentist is. Their friends, they're, what is this? What you're inventing this time? What is it? And they, whoa, this is a device that is causing faster movement for me. I'm finishing my treatment faster. I'm feeling less pain. Whoa, who is your dentist? Understand the logic here? So everyone, this is what I have for today. Okay, I hope I could encourage you to maybe look for this technology. Okay, if you have any questions, I'm at your disposal now, or if you want to make any questions later, if you are going to see this recording later, don't hesitate to make the question to OIGS team. They are great. They are going to forward the question to me, and I'm going to answer as fast as possible, the most complete way. Okay. In this process that Dentsply Sirona bought Propel, and now they own the Vipro, they are still certifying this device in a lot of countries. They are changing the certification from one company to the other. We know this takes time, and some countries they don't have it. Okay, but let me know. I would help as much as I can, and don't be afraid to make the questions. Okay, be ready for the next classes. Okay, next one we are going to keep talking about this topic, but with micro osteoperforations in mind, and then the other one, corticotomies, right, with and without bone graft. And also we have in front of us orthodontic cases and the combination, powerful combination between ortho and restorative. Valeria and OIGS team, please let me know if we have any questions for today. I hope you could enjoy it, and I hope you can start using this technology as soon as possible. Okay, let me check here. Let me see if we have any questions for today. If not, well, they are checking for questions. Don't be shy. Okay, I really loved this part, answering. The previous classes, you didn't made any question almost, so the questions came after 1 or 2 days. Okay, there's not a problem. I'm going to answer anyway, but since we are connected here, I have the capacity of going back. Oh, we have one. What's the cost of the device? Great questions, okay? Because this is something I researched a lot when I was looking to something to accelerate my treatments, to make aligners more predictable, okay? So this device in United States, which is the country that it was launched, the cost of one device, it's around $400, $500, okay? Something that I used to include in my package fee, right? Of course, I calculate all the costs and include this cost, and then I offer to my patient as included, okay? In the beginning, I was offering as an optional, okay? They can select if they want or not. With time, after seeing that it was great to the patients, that the patients were really happy, no patient ever regret buying it, I started including in my package, because in the end, even if I didn't charge all the costs of this device, by reducing the number of visits, by reducing the treatment time, in the end, it was profitable to me, so I decided to include it, okay? Now, the cost will depend on the country you are. This is just for your reference, okay? I recommend you to look for Dentsply Sirona if you don't have them in your country. You can look for high-frequency vibration devices, okay? The tip I give to you, be sure that it's a high-frequency vibration. It needs to have more than 100 hertz, ideally 120, okay? And if you have other companies working with it, give it a try, okay? Question number 2, are those disposable? Well, they are made for one patient usage only, okay? And why? I asked the company when I started using, because I thought maybe one device can serve several patients, okay? But imagine that this device is rechargeable. That it has a battery that it's like our smartphone, you need to recharge, and this battery has a life, right? And imagine that it's interesting for the patient to use not only during ortho, but also in the retention phase. So I like the idea of my patients using the long term. So I sell this device to my patient, I include, and I don't ask it back. It's their device, okay? So they're going to use during the whole treatment. What happened in a lot of times, imagine you have two patients, they are married one to the other, okay? And they want to buy one device for both of them. No problem at all. You just need to explain that because you have two people using the same device, you are going to double the usage and the battery life may be reduced, and at one moment the battery is going to be lost, okay? So they need to be aware of it, okay? But I never resell a used one. First, because patient is biting something in his mouth, and because the battery maybe is not 100%, and maybe we won't have the ideal effect after some years, okay? The only situation that I say that can be done is for people in the same family, the same house, that there's no problem to share this device. Okay, it's up to them. If my recommendation to you is don't make you this decision for the patient. Explain to them, explain that it's a single person device, and if they want, it's their decision. You are explaining the facts, okay? But great question. This is something that always people ask me, and this is the explanation I usually do for my patients, and really makes sense to them, and they like. Another thing that I like to encourage you, and it's related to the first question about the cost. It's very normal for many countries to consider it an expensive device. In United States, for them, it's not a big deal, okay? In Brazil, it's a huge deal. So in the beginning, I was figuring out if it's something I would sell to my patients because it's too expensive. This was my thought. But as soon as I saw the outcomes and the effect in the quality of the treatment of my patients and their happiness, I understood that we cannot make this decision to them. We need to offer. By offering, they are going to realize that we are very updated in our field, and it's their decision. They are the ones who need to consider expensive or not. Okay, we are here to study, to understand if it makes sense, if it works. I recommend you to test in 1, 2, 3 cases. Okay, maybe you can select some cases and then explain to the patient that you are going to test, and don't charge. Choose patients that you really know to explain this and not be in a bad situation. Okay, and then using 3 patients, and then after this, having this casuistic, you can explain much better to the other patients. And this is the technology. This is how much it costs. Do you want or not? It's simple. Not for us to say, oh, it's expensive, I'm not going to offer. Okay. The worst case, the worst thing that can happen is, imagine that you are not offering because you thought it was expensive, and then some other dentist of this patient discover in another, in the social medias, in the Google internet, or hear from other dentists that exist, and he's going to ask, why didn't you offer me this? How can you say to this patient, because I thought it would be too expensive for you? This is not something you can say, right? So it's not up to us to decide this, okay? So don't feel impressed by the cost. Just study if it makes sense. Offer, explain to the patient that exists, and try for at least 3 cases, in my opinion, okay? Any other question, Valeria? But thank you for the questions today, okay? Okay, I think we had an intense class today, right? I really like this topic, although it's kind of simple because it's not a surgery, not something that we really need to change biomechanics, and for some people it seems too simple, but it really has science behind. It really has a lot of cases, and I hope you enjoy it. Okay, so see you in 2 weeks when we are going to discuss the part 2, micro perforations. I have plenty of material and cases for us to see together, and hopefully you are going to fall in love with this technique the same way I did some years ago. Okay, bye bye, see you then.